Hello, and welcome to Safe and Sound with CCOHS. We're here today with Janet MacEachern, Chief Executive Officer of the Association of Workers' Compensation Boards of Canada. Janet leads national efforts to sorry. Janet leads national efforts to advance excellence in workers' compensation through collaboration, data stewardship, and knowledge exchange among Canada's provincial and territorial boards and commissions. She joins us to discuss national injury trends and how workplaces can use that data to support prevention on a local level. Janet, thanks so much for being here.
Thank you very much, Ashley. I'm really feel very fortunate to be asked to do this podcast today, and any efforts to collaborate with CCOHS, we're always happy to do so.
We love it. Your organization plays a key role in collecting and sharing data across jurisdictions. Can you walk us through what that data includes?
Absolutely. So at the Association of Workers' Compensation Boards of Canada, we call it AWCBC, we bring together data from the 12 provincial and territorial workers' compensation boards of Canada to create a truly national picture. So this includes, for the most part, claim-related measures such as injury frequency, accepted lost time claims, accepted workplace fatalities, return to work outcomes, and claim duration. We also look at other measures, some of the more financial measures like benefit payments, administration costs, and overall system funding. So through we have a program called the National Work Injury Statistics Program, NWISP program. And through that, we also capture more of the detailed, nuanced information on work-related injuries and diseases across industries, occupations, and it's broken down by factors such as age, gender, type of injury, and even the part of the body that's affected. So our role at AWCBC is we collect and we standardize and share that information so that it can be compared across the jurisdictions. That consistency allows employers, policymakers, health and safety professionals to identify trends, to better understand the risks, and to support evidence-informed prevention efforts in their own context. So while we at AWCBC, we don't develop prevention policies ourselves, but we provide that foundation, that crucial foundation that can help others turn that data into action.
Right.
So yeah.
Yeah, so incredibly important information to be collecting and sharing. Tell us a little bit more about evidence-informed prevention. What does that mean in practice?
Absolutely. So basically, in practice, the evidence-informed prevention is really about using that reliable information to guide decisions rather than relying on assumptions. It's important for example, when employers or policymakers out there are identifying higher injury rates in a specific industry or patterns and types of injuries, that they can focus those efforts where they'll have the greatest impact. It's about using those insights to better understand risks and take targeted action, rather than adapting training, improving workplace practices, or strengthening return to work approaches. So ultimately, it helps to ensure that prevention strategies are grounded in that real world evidence that's going to be more effective.
Right. What are some ways employers and health and safety representatives can use data more effectively?
Good question. There's a few different practical ways that they can really elevate their approach. First off, we would say benchmarking. So benchmarking using national and jurisdictional data to understand how their organization compares in terms of injury rates or claim durations. From that, you can figure out what the gaps are. And then second is the trend analysis. So looking internally at their own data over time to spot recurring issues or emerging risks. So you can look at what those recurring issues are and try to approach what you need to do differently that way. It's really important to look at emerging risks, though. So catching it before it becomes, an increased injury. And then third is the targeted action. So using the insights like the injury type, the cause, the affected body part to tailor safety programs and training. So the key really is to move from simply collecting the data to actively using it to make decisions. So whether that's improving return to work programs or focusing on high risk roles.
Right, that makes sense.
Yeah.
How can workers' compensation boards, employers, and other partners across the country work together to improve outcomes?
This is really crucial, and it really comes down to where that collaboration comes into play. Is quite critical. So workers' compensation boards, they provide the data and that system level insights, and then from that, employers and health and safety professionals can bring the frontline experience. Researchers, policymakers, academics, they can help translate those findings into action. So by sharing data across the jurisdictions while recognizing differences in legislation or industry mix, we can identify national trends and learn from each other's successes. That kind of collaboration, it really enables more consistent approaches, better prevention strategies, and ultimately improves the outcome for workers across this country.
That's what it's all about, really.
Yeah, exactly.
If there's one thing you'd like our listeners to take away from today, what would that be?
So one takeaway, I mean, this is a topic that we could talk for an hour or more on easily, right? Like so crucial. But I think one takeaway would be having access to that reliable, comparable information. It's essential to improving workplace health and safety. So when information is standardized, like what we do, and shared across the jurisdictions, it gives employers, the policymakers, the health and safety professionals, the insights they need to make informed decisions, and that's important, the informed decisions, and be able to take meaningful action that's going to have positive consequences and outcomes. So at AWCBC, our role is to provide that national picture, so helping others better understand what's happening and where efforts can make the greatest impact, so where they need to, the direction they need to look in. Ultimately, it comes down to how we support the safer, healthier workplaces across this country. And one last thing I will say, it's just a pitch,
Please.
but for those interested in learning more about what we're able to offer for them, I encourage them to visit our website at awcbc.org. We've got fabulous amount of data there. We've got, you can look at our year at a glance to really get an understanding of what's happening currently across the jurisdictions and at that national level. And there's a lot of publicly available resources. And just reach out to our staff. We're able to help with any nuanced data requests that they're looking for to help them in in looking at their prevention and their health and safety programs. We're here to help, and it's all free resources that are available.
Amazing. Absolutely. Be sure to take advantage of those fantastic resources. Janet, thank you so much for joining us and sharing your expertise today.
Thank you, Ashley. I really appreciate this opportunity.
For more information on incident prevention and all things workplace health and safety, visit our website, ccohs.ca. Thanks for listening and stay safe out there.